Hello, great nurses. This is your career coach. Welcome to the Career Pathway channel. Here we guide nurses on their career pathway. Today we'll be looking at NUS 112 Applied Physics. This course is designed to provide students with the basic knowledge of physics applicable to nursing. Let's see the general objectives for this course. Number 1. To understand the concepts and principles of physics and their application to nursing. 2. Understand molecular phenomena and their applications to nursing. 3. Understand specific principles of heat energy in healthcare interventions. 4. Understand the nature of radioactivity in relation to X-ray, radiological procedures, and radiotherapy. 5. Understand principles of optics and light waves in application to healthcare. 6. Know the various measurements and units relevant to nursing practice. 7. Understand the concepts and principles of elasticity and their application to nursing. 8. Know basic machines used in healthcare practices. 9. Know the principles of forces and their applications to nursing practice. This is what we'll be achieving 1 to 9. Circles to success. Circles to success simply tells us areas we must know for exam, good for clinicals, or areas to skim later. And so we have red circles, orange circles, and green circles. Red circles are must know for exams. Orange circles are good for clinicals, and green circles are to skim later. For the purpose of this video, all 9 objectives for this course, NUS 112, have been put into modules. So we have module 1 to module 9 for NUS 112. This video will cover NUS 112 module 1. Module 1 says understand the concept and principles of physics and their application to the nursing practice. Specific objectives for module 1 are as follows. To define the following terms: science and physics, enumerate and the branches of science and their relevance to nursing practice. 3. List the branches of physics and their relevance to nursing practice. So we'll be looking at objective number 1, which says to define science and physics. What is science? Science is the systematic study of the structure and behavior of the physical and natural world through observation, experimentation, and reasoning. Key points for nursing. Science provides a foundation for evidence-based practice, explains biological, chemical, and physical processes in the human body, enhances problem-solving and critical thinking in healthcare. What is physics? Physics is a branch of science that studies matter, energy, motion, forces, heat, light, sound, electricity, and their interactions. It explains the fundamental laws governing the universe and how physical systems behave. To the nurse, physics principles are applied in various nursing procedures and technologies, such as IV fluid flow, blood pressure measurements, oxygen delivery systems, and medical imaging, such as X-rays and ultrasound. Objective number 2. Take note of the red circle to success. It means these areas are very necessary or vital for your examination. Objective 2 says enumerate the branches of science and their relevance to nursing. Take note of this salient point. All branches of science interconnect in nursing. For example, when you give insulin, that's chemistry, right? If you do that to a diabetic patient requiring understanding glucose metabolism, that's biochemistry. So you need to understand how insulin works, and that's biochemistry, the human body. Pancreatic function, that's physiology, and the proper injection technique, that's anatomy plus physics. Branches of science and their relevance to nursing. We're looking at physical sciences. Physical sciences cover physics, chemistry, astronomy, and geology. How is it relevant? It's relevant in the sense that it makes us understand chemical reactions in the body, principles of energy, and physical changes. Biological science. Biological science covers biology, zoology, botany, and microbiology. Its relevance: it aids understanding of anatomy, physiology, microbiology for infection control. Another branch of science is social science. Social science covers sociology, psychology, anthropology, and economics. How is it relevant to nursing? It helps us understand patient behavior, cultural influences, and social determinants of health. In continuation, we'll look at formal sciences. Formal sciences cover mathematics, logic, and statistics. How is it relevant to nurses? Dosage calculation, research analysis, interpretation of lab results. Number 5 is applied sciences. Applied sciences cover medicine, nursing, and engineering. How is it relevant to nurses? It gives us practical application in diagnostics, treatment, and patient care. Let's look at a summary of the branches of science and their relevance to nursing. Biology is the study of living organisms and life processes. It is essential for understanding human anatomy, physiology, disease processes, infection control, and pharmacology. Nurses apply biology when assessing vital signs, managing wounds, or administering vaccines. Chemistry is another branch of science which says it's the study of matter, its composition, properties, and reactions. It is crucial for understanding of drug interaction, metabolism, acid-base balance, electrolyte imbalances, and laboratory diagnostics. Example is your blood glucose and arterial blood gases. Physics is the study of matter, energy, motion, and forces. Applied in medical equipment, for example, syringes, infusion pumps, monitoring devices such as your sphygmomanometer, and imaging techniques such as your ultrasound and that's your MRI. So let's continue. Anatomy is the study of the structure of the human body. Nurses must know anatomical location to give injections, insert catheters, and perform assessment accurately. Physiology is another branch. It deals with the study of how the body system functions. This helps nurses to understand normal versus abnormal finding. Example is heart rate and respiration when they are normal or abnormal, and respond appropriately to changes in the patient condition. Another branch of science is microbiology. It studies microorganisms such as bacteria, fungi, and viruses. It is vital for infection prevention, sterilization techniques, understanding sepsis, and antibiotic therapy. Objective number 3 says listing the branches of physics and their relevance to nursing. This is a salient point. When a nurse adjusts IV drip rate using gravity, they are applying fluid dynamics and mechanics. When using a thermometer, they apply thermodynamics. When reading an ECG, they rely on principles of electricity. We'll be looking at the branches of physics and how they relate to nursing. First is mechanics. It is the study of motion and forces. How does this apply to nursing? Patient handling, wheelchair movement, and lifting techniques. You don't just lift patients anyhow. There are techniques in lifting, and when you do so, you apply mechanics. 2. Thermodynamics. It is the study of heat and temperature. How is it relevant to nurses? Sterilization techniques, temperature regulation in patient. All these are thermodynamics. 3 is optics, the study of light. How is it relevant to us? Use of microscopes, corrective lenses, and laser therapy. Acoustics is the study of sound. It relates to nursing in that it helps us understand ultrasound scanning, scope use, and of course, hearing aids. Number 5 is electricity and magnetism. It is the study of electric current and magnetic field. How is it relevant to nurses? Use of ECG machine, MRIs, and defibrillators. Nuclear physics is the study of atomic nuclei and radiation. How is it relevant to nurses? Radiotherapy, X-rays, and nuclear medicine. 7. Fluid dynamics. Fluid dynamics is the branch of physics that studies fluid in motion. How does it apply to nursing? It applies to us in understanding blood flow, IV infusion, and blood pressure. Let's look at a summary of it. The branches of physics, their definition, and their relevance to nursing practice. Number 1 is mechanism. The study of motion and forces acting on objects. It's used in understanding body mechanics to prevent injury during patient lifting or patient transfers. Applies to IV fluid flow, that's gravity, drip rate calculations. It explains blood flow dynamics in vessels, blood flow dynamics in your blood vessels, pressure and resistance. 2. Fluid dynamics or hydrodynamics. It is a study of fluid, liquid and gases in motion. How is it relevant to nursing practice? It is critical in intervention therapy, understanding flow rate and tubing resistance. It applies to respiratory therapy, airflow in lungs, oxygen delivery via nasal cannula or nasal ventilators. Understanding edema, formation of water gathering at a particular area of the body, formation due to hydrostatic pressure changes. So that is fluid dynamics in physics. Thermodynamics is the study of heat, temperature, and energy transfer. It is used in temperature monitoring, hypothermia or fever, guides therapeutic hypothermia post-cardiac arrest. It's important in sterilization processes. Autoclave uses heat under pressure. That's the working principle of an autoclave. You must have seen an autoclave. It applies thermodynamics. Number 4 is physics, optics. Optics is a branch of physics that studies light and its properties. How is it relevant to nurses? It's used in the diagnostic as a diagnostic tools in ophthalmoscopes, otoscopes, and endoscopes. It applies in pulse oximeters, which use light absorption in the measurement of oxygen saturation. Acoustics, which I said before, is a study of sound waves. It is relevant in auscultation, using stethoscope to hear heart, lung, and bowel sounds. Basics of ultrasound imaging, example, fetal monitoring, abdominal scan. So acoustic is the basic of ultrasound imaging. 6. Electricity and magnetism is another branch of physics that studies electrical charges, current, and magnetic field. How is it relevant to us? It is essential for understanding CG and EKG machines, defibrillators, and of course, patient monitors. Safety around electrical medical devices, such as avoiding shocks and grounding. When you understand electricity and magnetism, you'll be able to apply safety in using electrical devices. It is also the basis of MRI, okay, and every technology behind magnetic resonance imaging. 7. Radiology, which is the nucleus physics. It studies the radiation and radioactive substances involved in physics. Nurses care for patients using X-ray, CT scan, and radiotherapy. So we must understand radiation safety and protection principles. And also the knowledge of radiology helps us to monitor patients for side effects of radiation treatments. Okay, with this, I want to reiterate the circles of to success. We must take note of the definition of science and definition of physics. We must also take note of the definition of the branches of physics that are relevant to nursing. We also take note of the branches of science and how they are relevant to nursing. I want you to answer these questions in the comment section. Answer these questions in the comment section of this video. When administering IV fluid, why is the height of the IV bag important? Number 2, why should nurses bend their knees rather than their back when lifting patients? Okay, these are the options. Number 3, how does a pulse oximeter work based on physics principles? Why do pressure ulcers develop more easily over bony prominence? When using a syringe, why does pulling back of the plunger create suction? These questions should be answered in the comment section. Please answer these questions in the comment section so I will know if you follow the class, okay? In case you've not subscribed to this YouTube channel, kindly subscribe to the YouTube channel, turn on your notification bell so you get subsequent videos like this, as it helps me know if you are following the class. I want to thank you for staying this long. See you in our next video for Module 2.